Cell adaptation and cell injury are two important concepts in cellular biology that describe the response of cells to changes in their environment. Cell adaptation. Cell adaptation refers to the ability of cells to adjust their structure and function in response to changes in their internal or external environment. It is a mechanism by which cells can maintain homeostasis and survive under different conditions. There are three main types of cell adaptation. Hypertrophy. Hypertrophy occurs when cells increase in size in response to increased demand or stimulation. For example, skeletal muscle cells, because increase in synthesis of cellular protein, undergo hypertrophy in response to regular exercise. Hyperplasia. Hyperplasia refers to an increase in the number of cells in an organ or tissue. It occurs in response to increased physiological demands or specific stimuli. An example of hyperplasia is the proliferation of glandular cells in the breast during pregnancy and lactation. Atrophy. Atrophy is the opposite of hypertrophy and refers to a decrease in cell size or number. It occurs when cells are no longer needed or when the body's resources are limited. For instance, skeletal muscle atrophy, because decrease in protein synthesis, can result from prolonged bed rest or immobilization. Brown atrophy of heart is due to accumulation of lipofuscin pigment. Metaplasia. It's a reversible change in which one differentiate cell type, mature cell type, change into another one. Basically, it is reprogramming of stem cells. Vitamin A deficiency can lead to metaplasia. Example: most common metaplasia seen in smokers: pseudostratified, ciliated columnar epithelium of respiratory tract converted into stratified squamous epithelium, squamous metaplasia. Cell injury. Cell injury refers to the disruption of normal cellular structure and function due to various stressors, such as physical trauma, chemical exposure, infections, or ischemia, lack of blood supply. Cell injury can occur reversibly or irreversibly, leading to cell death. There are two main types of cell injury. Reversible cell injury. Reversible cell injury occurs when cells are exposed to mild or short-term stressors. The affected cells can recover and return to normal function if the stressor is removed. Common examples include cellular swelling, cellular edema, and fatty changes in the liver. Irreversible cell injury. Irreversible cell injury occurs when cells are exposed to severe or prolonged stress, causing irreversible damage. This can lead to cell death by either necrosis or apoptosis. Necrosis is characterized by cellular and tissue damage, inflammation, and loss of membrane integrity. Apoptosis, on the other hand, is a programmed cell death that occurs in a controlled manner, without eliciting an inflammatory response.